does 50 a year or 200 a year, they're all going to get good success rates because the technology is helping you along. It's also made the procedure much quicker. So most procedures now take about an hour. Most patients now go home the same day.
Wow.
We do them without interrupting anticoagulation. So they're NOACs. They do not need to interrupt the NOACs. They come in the morning, have their dose of NOAC in the morning as planned. They have their ablation procedure, go home in the afternoon. And so AF ablation has now become a much more straightforward, a day case procedure, which has meant that we can now offer it to more and more people.
Wow, I mean, incredible advancements in technology. I can't believe we're now in an era where catheter ablation can be done as a day case procedure. So we've talked about the tremendous benefits. Let's be fair and balanced, though. Talk to us about the risks of catheter ablation.
Okay, well, obviously, catheter ablation is an invasive procedure. So we always want patients that it cannot be 100% risk-free. So the risk of complication overall, certainly major complication overall, is no more than 1 to maximum 2%. The most common complications are benign, such as bruising around the groin area, because we are obviously accessing the right femoral vein. The groin complications are reduced considerably now by using ultrasound for groin access, which most centers are doing. In terms of major complications, there's a 1 in 100 risk of cardiac tamponade, but very often that is identified by physicians even before the patient is aware of them. So that can be managed. Very rarely, you can have serious complications such as damage to the esophagus or damage to the phrenic nerve. But in experienced centers, these should be extremely rare. Because the risk-benefit ratio is now so heavily in favor of the benefit, all the current guidelines on both sides of the Atlantic have advocated AF ablation as first-line treatment for patients with paroxysmal atrial fibrillation. And they won't do that if the risks of the procedure were prohibitive.